Hello everyone, let's put our hands together and welcome Dr. Akhil, a proud DAMS student, and he secured a rank 8 in May AIIMS postgraduate entrance exams. Heartiest congratulations, Dr. Akhil.
Thank you, ma'am. Thanks,
we are very, very happy and proud to have you here.
Thank you.
How do you feel? That's the first cliche question, right? How do you feel?
I'm feeling amazing.
He's feeling amazing.
Actually, I expected a rank between 50 to 80 after checking the key.
Okay.
After the exam, by discussing with friends, but this 8 I never expected. So
okay.
I'm actually recovering from the shock.
Wonderful, wonderful. So he's recovering from the shock of happiness. And no, it is absolutely a rank which you should be proud of, and I'm sure a lot of hard work has gone into that rank.
Okay.
That's what we are here for, to know what you've put in, so that we can help a lot of other people around to, get into the same shoes, right? So Akhil was an AIIMS pattern TND student with us. It was a fast track TND. So he's going to tell us how useful was the course for you, Akhil.
Ma'am, actually I'm from AIIMS. I studied MBBS from AIIMS, and
great.
I completed my internship in December 2016.
Okay.
The advantage from AIIMS internship is it's very light, so you get time to study.
Okay.
So I used to study in my internship, and then I wrote November AIIMS, and I got a rank of 807.
Okay.
So I thought I won't get any good branches in AIIMS, so I thought I will study for May 2017.
Okay.
And I joined DAMS TND, fast track TND. It was actually very helpful. I actually attended the first 2 months class regularly, all subjects.
Okay.
Then after that, due to lack of time, I selectively attended the classes.
Yeah, because the fast track are going to be twice in a week.
We also need time also
yes,
to share. So,
absolutely.
So I selectively attended the subjects which I am weak. So in the first 2 months I attended every subject, so it was actually very helpful.
Okay.
They used to treat the recent the class was actually AIIMS based, so
yes,
the AIIMS pattern, AIIMS trends, they used to discuss more picture based questions, clinical based questions.
Yes.
And surgeries also, like they used asking from Bailey only these days, so
yes,
more of general surgery.
Okay.
And the test series were also very good. Online test series I used to give.
So he's done the online test series as well. Do you find the questions were helpful?
Yes, ma'am. The questions and explanations were really helpful.
Okay.
I didn't give every test series, but 2-3 subject wise test and or 2 to 3 grand tests also I gave.
Whatever you could manage in the 5 months time. So believe me, he's just started in December and he's made it happen in a span of 5 to 6 months. And securing a single digit rank is no joke. So definitely he has put in a lot of mind into it as well. The strategy and planning is as important as much as your hard work is.
Yes,
right? So he decided right to go ahead in December itself, and that's when he started studying. All right. So
I actually started studying from the start of internship.
Internship itself, yes. So he says he started
I couldn't get a rank
it
in November, but so I decided to go on with
up till May. So that was a great decision, right? And it's proved out to be very, very useful. So
yes,
sometimes waiting and persisting actually helps. You shouldn't really say quits, because it's easy to say quit, but once you persist, you get what you actually deserve, right?
Yes,
so again, very, very happy for you and on your performance.
Thank you.
Right. So what subjects did you like here at DAMS?
Okay, the first one was pediatrics. After my professional examination, I didn't study pediatrics and obs-gynae in whole internship.
Okay.
I just studied DAMS notes for pediatrics and obs-gynae.
Okay.
It was very useful. Nothing came out of that notes.
Okay. We are glad to hear that.
Also, this time obs-gynae was not that tough also, but so I think I could made all questions correct.
That's wonderful.
And pediatrics also I just studied DAMS note only, nothing else.
Okay.
And then for other subjects, but for microbiology also I studied DAMS notes.
Okay. And you had a lot of microbiology in AIIMS paper this time.
This year's lots of microbiology.
They've been asking a lot of questions. That's great. And did you appear for the AIIMS mock as well that we kept?
Yes, ma'am. I got 47th rank.
Oh, wonderful. So in the AIIMS mock, he got 47. Was it a positive booster for you to go ahead and probably...
It was actually a little depressing. But
it was a little depressing because he was expecting much better for... but either ways, it tells you what to focus on and how to go about it after that.
I was actually I haven't prepared the previous year questions, so some previous year questions were also there in the mock test, so I got all of them wrong.
Okay. And was the mock pattern helpful for you for the main exam?
Yes, ma'am. Almost a similar pattern only. Like for last 3-4 exams, it's having almost a similar pattern.
Yes.
So the mock test was also like that only.
Like that only. Okay, great, great. And did you attend the visual session that we kept?
No, I had my friend's DVT.
Okay.
I didn't attend DAMS last year, so
Okay.
I couldn't attend the DVT.
Okay, but you got the images.
Yes.
So he studied the images. Were they useful for you?
Very, especially the gynae ultrasounds. I didn't know what to see in the ultrasound. Especially those ultrasounds were very useful, and surgery also was very useful.
Surgery was useful. That's great. That's great. And could you, because you did a fast track course, Akhil, and there are a lot of other people who would want to do it from now up till November. Like you decided to do it from November to May. Could you help them with, how to go about in this short span of time? And yes, definitely tell them that it is possible, right? It is definitely possible. And how could they, sort of do things in short span of time for those who are going to prepare for November AIIMS?
First of all, we need a planning. We should assess where we stand.
Okay.
Because I started studying from internship start, so I knew I have studied something, so I could build upon. So if you are in a position like that, you should really go for fast track TND.
Okay. So he's saying if you want to go for fast track, there has to be some base. That's what he's saying. You can't be totally raw because fast track is fast track. So you have to have a base, and then that's what he says he worked on it. Okay, great.
If you are in such a level that if you are confident that you can do, then you should really go for fast track. And you should revise the subjects you have already studied in final prof or second prof.
Okay.
Then I think it's not, it's difficult, but it's not that difficult. It's not impossible to get into it.
Of course not. You have done it. So how can we say it is impossible? It is very, very much possible, right? But you need a lot of hard work and persistence in those 4-5 months.
It's really frustrating, and it's really a tension type of thing.
Yes, the stress levels are very high. Yes, that's true. That's true. So how did you cope up with the stress?
I used to call my home every day. Used to talk.
Wonderful. So something that I would like to say to all the students who are preparing, you are far away from home. You are in an environment which is stressful, and you should ensure that you have some stress busters. It could be friends, it could be family. Stay in a good mental health. Stay positive, and people like Akhil are there to boost you. They are real examples, real heroes. That if you put in the right amount of effort, everybody can do it. Right, Akhil? Can everybody do it?
Obviously, everybody can. And we were also having my batchmates were also preparing.
Yes.
So we could discuss things, and they were also boosting.
So see, that's what I said. It could be friends, it could be family, it could be anybody. But you should talk it out. Seek help whenever you want to. Go out. Have some kind of change in your environment when you feel stressed, and that always helps to bounce back, right? That's great. That's great. And you said you gave the grand test as well for us. So were the grand tests useful? Did you listen to the videos of the grand test?
I didn't listen to the videos. I just downloaded the PDF answer.
Okay.
And I also couldn't completely read all the explanation because of lack of time.
Yeah.
I just read through the explanations which I made wrong.
So something that again people should learn. How to use the grand test. So especially when you are preparing in a shorter span of time, he's saying work on your weak areas, and that's what he did. He worked on his questions that he did wrong and maybe read them in depth. Yes.
For final prof, I didn't study surgery very well, so almost 1 month in this 5 months you
had to study surgery. So very important. Every one of you should know what your weak areas are, and you keep hammering on your weak areas, and then you could bring up your scores in the main exams as well. Wonderful. Any other piece of advice, Akhil, that you want to give to your juniors?
Just work hard. If I can do it, everybody can. I never expected a rank within 10.
Okay.
So just work hard. Rest everything is upon the Almighty. So if you are deserving, you will get it.
Wonderful, wonderful. And should they join DAMS?
Obviously, I highly recommend DAMS. The class notes are actually very good. The teachers are also very good. The test series is actually excellent.
Okay, great.
So
great. So any teachers that you personally liked, as far as the subject is concerned, or who have left an impact, and you find it useful?
I don't remember the name, but the ENT's teacher was nice.
Great.
Then surgery, the sir was good, but there were two teachers.
Yes, so we usually divide the bigger subjects into smaller parts.
Both were really good.
Great. So that's great. So thank you, Akhil, for being here.
Thank you.
And we wish you loads of good luck for your bright future, and may you turn out to be... Oh, I didn't ask you. What do you want to pursue?
Actually,
So he's still in a dilemma.
Yes,
He doesn't know. So anyways, let's wish him good luck for whatever he wants to become. I'm sure he's going to be a great doctor, a great physician, or a great surgeon, or a great radiologist, right? And he's going to be helping mankind. Yes. Thank you so much, Akhil, for being here. It is a pleasure to have you here, and I wish you loads of good luck for your
Thank you,
future.
ma'am. Thanks a lot.
Thank you.